I'm going to start with a warm-up 12 lead, and I don't know if you can see it in the back. You can always move up, but I know the people in front can see it. So what do we think this is?
Pure
So,
ugliness.
what's that?
Is that pure ugliness?
Well, yeah, that too.
Is that VTAC?
Say it again?
VTAC?
Well, you're definitely smarter than the monitor, okay? Because look what it says. Okay, it says left bundle branch block, okay? Now, why is it not a left bundle branch block? Yeah, it's not supraventricular, right? And then, certainly the shape in V1 is a left bundle branch block-like pattern, but if we do our additional criteria, if you're sort of sucked in thinking, you know, maybe it's an IVCD, you forgot to check for P waves, but V6 doesn't look anything like a left bundle branch block pattern. So again, stupid monitor, what can I say? But watch out for this, because remember, the thing about ventricular rhythms is the QRS has all kinds of different shapes, and it can look like a bundle branch block. So always do that first step. Is it supraventricular? Is the QRS wide? Okay, so we're going to talk about Sgarbossa criteria, named for the cardiologist Elena Sgarbossa. And Brandon, what is this? No tricks. Yeah, left bundle branch block. Okay. We know that the ST elevation, so let me ask you, Kyle, if I say to you, is there a STEMI up to this point, what's your answer?
Up to this point, no.
No, not no.
Well, we can't tell because it's a left bundle branch block.
Yeah, Grace, tell me about the left bundle branch block person in the ED that you had with troponin levels.
Yeah, so his troponin levels spiked 185 points, but
Yeah.
he had a left bundle branch block.
Yeah, so you can have an acute MI with a left bundle branch block, you just can't tell. The left bundle branch block pattern obscures the STEMI pattern. Doesn't mean it's not there, you just can't see it, okay? So what we see in the left bundle branch block, the thing that makes it look so much like a STEMI is we have ST elevation, and we have big T waves, and we even have some ST depression, all things that add up to really bad ACS and maybe a STEMI, but that's part of the typical pattern of a left bundle branch block. So prior to the development of Sgarbossa's criteria, it was thought it was impossible to discern an acute MI when you're looking at a left bundle branch block. And for the most part, I want to emphasize that's still mostly true. Okay, that's still mostly true. However, the criteria shows a way that occasionally, only with a left bundle branch block, this has nothing to do with right bundles, occasionally with a left bundle branch block, you can say, yes, there is a STEMI, okay? Now, first we have to learn, there's all these great, appropriate discordance, okay? So we know what appropriate means. What does discordance mean?
The opposite side of the isoelectric lines.
What does the term discordance mean?
Wow.
Like,
Chaos.
oh, I like that, chaos. Yeah, wacky, that's good. I was going to test the volume for the next slide, and I haven't done it yet, and I think it's pretty loud. And the speaker is right there, so you might want to, I was going to test it, and I didn't have time beforehand. Here we go, discordance. Okay, there we go. Keeps me happy anyway. Okay, so in terms of a left bundle branch block, dissimilarity is probably the best synonym. In a medical setting, discordance means dissimilarity or difference. And it's not just used for in ECG, for ECG observations. For example, if you have a genetic trait in only one member of identical twins, that's known as discordance. So it's things that are different, okay? So what does it have to do with left bundle branch blocks? So first of all, when we look at the 12 lead of a left bundle branch block, one thing that we have not mentioned, is that the QRS complexes, not always, not entirely, but frequently are either mostly or entirely positive or mostly or entirely negative. So, for example, this comes off of a left bundle branch block, and this is leads 1 and 2, mostly positive. In fact, that's one of our criteria for lead 1, okay? And if we look at other parts of it, mostly negative. So in this one, V1 is entirely negative, and this one it's mostly negative. So let's go through here, and Natalie, if you wouldn't mind, if you just go through and look at lead 1, tell us, is it mostly positive, mostly negative, or neither, and go through all the leads.
1 is positive, 2 is mostly positive, 3 is mostly negative.
Uh-huh.
AVR mostly negative, AVL mostly positive, AVF mostly positive, V1 mostly negative, V2 mostly negative, V3 mostly negative-ish, V4 kind of in the middle,
Yeah, kind of in the middle.
V5 mostly positive, V6 mostly positive.
So, I've cherry-picked a little, but generally speaking, it's true. Now, you could find a left bundle branch block where there's more ones like this that are more equiphasic. But still, what you're going to see is the majority of the leads in left bundle branch block are either mostly or entirely positive or mostly or entirely negative. So, for example, here's another one, and I'll do the honors. So positive, more equiphasic, mostly negative, mostly negative, mostly positive, mostly negative, 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 equiphasic, positive. So again, most of the time it fits. So the rule of appropriate discordance, so remember what that means is we're saying some kind of difference that's appropriate, that should be there, that we expect to see, is that with a normal left bundle branch block pattern, if the QRS is mostly positive, then there should be ST depression and the T wave will be inverted. Conversely, if the QRS is mostly negative, there should be ST elevation and an upright T wave. So in other words, whatever the direction the QRS goes, the ST segment, the J point, is going to be the opposite, and the T wave is going to be the opposite. So if the QRS goes up, ST depression, T wave goes down. If the QRS goes down, ST elevation, positive T wave. The reason that I have this in parentheses is not because it doesn't matter or it doesn't happen. It's because in terms of Sgarbossa criteria that we're about to explain, it's the ST segment that matters, not the T wave, okay? So let's look. Now we're going to see, do we have the rule of appropriate discordance? So Grace, appropriate discordance? Yeah, because we have a positive QRS, a little bit of ST depression, so the J point's down is below the isoelectric line, and the T wave is inverted. Same thing here. Okay? So that's appropriate discordance. That's what we expect to see. Okay? So, and do you see appropriate discordance here? Yes. Yeah. So the QRS goes down. The J point is above the isoelectric line, and the T wave goes up. Okay? And again, for our purposes, for Sgarbossa criteria, I'm much more interested in the J point than the T wave, okay? Okay, so again, here's appropriate discordance. This goes up, this goes down, this goes down, this goes up. Okay? Okay. So again, I'm not going to make you go through it, but if you sort of scan through, you can see nearly everywhere. This one is a little equivocal, but nearly everywhere else you see appropriate discordance. Now I'm going to make it easier for you to say. Anybody know Jesse White?
I wish he looks cool.
What was that?
I wish he looks cool.
He is cool. He's I assume he's still cool. He was cool when he was here. That was about 5 years ago. And he, again, I don't know exactly where he is now, but he worked for out in Hood River, okay? And we were doing this absolute same class, and he goes, oh, I know what appropriate discordance is. He says, with a normal left bundle branch pattern, you should either see an uppy with a downy or a downy with an uppy. Okay? Easier to remember, easier to say. Once you got it in your head, it's even better than circus ponies. Okay? So this one really works. The only thing with this one is it's so pervasive that until it takes over the paramedic universe, when you do your HEAR reports, don't say things about uppies and downies. Okay? So, if the QRS is an uppy, the ST depression and the T wave are downies. If the QRS is a downy, this is an uppy. So, appropriate discordance, uppy with downy, downy with uppy. I'm totally okay if you use that because I like it too. Okay, and again, you can go through and look at the uppies and the downies. The only thing I don't like about it is if you're printing it, spell check keeps changing it to guppies. So, okay. Okay, so is there any question about appropriate discordance? Because you really have to have it firm in your head before we talk about Sgarbossa. Just remember, uppy with downy, downy with uppy. That's appropriate discordance. By the way, I asked him if I could put his picture and name his rule after himself, and he was like, sure. So, yeah.
Are those actually left bundle branch blocks? Like,
Well, you don't know. You don't know because it could be. You don't know which lead it comes from.
but isn't that if it came from one, wouldn't that be a right?
No, but it doesn't have to come. Like, let's go. That's a great question. Let's go back. So here, for example, we have an uppy with a downy. Okay, so it depends on the lead. Great question. Okay. Okay. Now, there are actually 3 Sgarbossa criteria, which are, I don't think Sgarbossa herself used the term Sgarbossa A, B, and C, but that has become common usage, so we're going to use it. However, and I'll tell you why in a little bit, I'm only going to require you to know Sgarbossa A and Sgarbossa B. And the reason is Sgarbossa C is a little is just a little confusing. But A and B are really straightforward, okay? So I'll read through it. You'll go, wait a minute, what does this have to do with uppies and downies? And then I'll show you examples, and it'll make total sense. Now, if something is not discordant, it's concordant. So if an uppy with a downy is discordant, an uppy with an uppy is concordant. A downy with a downy is concordant. So that's what that means. So concordant, ST elevation greater than 1 millimeter in any lead with a positive QRS. Okay, and I'm going to show plenty of examples. So even if you're thinking, I still don't know what that means, you will pretty quick. Sgarbossa B only applies to V1, V2, and V3. Okay, Sgarbossa A applies to any lead that has a positive QRS. Sgarbossa B only V1, V2, and V3, and what you want is concordant, or you don't, because of how you're thinking of it, concordant ST depression. Okay, so let's look at some examples. Okay, Sgarbossa A only applies. So first of all, you have to have a left bundle branch block, right? Left bundle branch block. If you have a left bundle branch block and you're checking for Sgarbossa A, what you do is you go through and you find all the QRSs that are mostly or entirely positive. And, you know, the smart thing to do is to circle them. Okay, there'll probably be like 4 or 5 or 6 throughout the 12 lead. Find all the ones that are positive or mostly positive. So with appropriate discordance, if the QRS is positive, Natalie, what would you expect to see?
Negative.
Yeah, you would expect to see ST depression. Concordant it means that instead of ST depression, you see ST elevation. Okay? You see an uppie with an uppie. Okay, don't worry too much about the T wave. We're just going to worry about the J point. Uppie with uppie is Sgarbossa A. Okay? If you see it even in just one, doesn't have to be 2 or 3, doesn't have to be contiguous, just one, that's really good evidence for STEMI.
Just one.
Just one. Okay, and it's not necessarily localized. So if you were to see in lead 3, you were to see, concordant ST elevation, uppie with uppie, it doesn't necessarily mean it's inferior. Maybe inferior, but not necessarily. Okay, it only takes one Sgarbossa A. Sgarbossa A, uppie with uppie.
Okay.
Okay. Now, which leads did I say Sgarbossa B applies to?
V1, V3.
Okay? Now, V1 and V3, what you're going to learn pretty quick in left bundle branch block is almost always the QRS goes down. Okay? Sgarbossa B, concordant ST depression greater than 1 millimeter of V1 through V3 is downy with downy. Okay? All you need is one, and it's a STEMI. It does not necessarily mean a septal anterior STEMI. Okay? It doesn't localize in the same way. Okay?
So you just call it like a generalized STEMI? You can't determine the location?
Correct. The way you would do it is you say, I have a left bundle branch block. I think it depends on where you work, as always. What I would do is I'd say I have a left bundle branch block and I see presence of Sgarbossa B in V3. I'd like to do a STEMI activation, and then I'd probably go, I really don't know, she really knows Sgarbossa B. And then, and then you can deal with that, however you deal with that. Okay. Now, the way I like to do it, and again, this is just, for whatever reason, I think it's easier to look for Sgarbossa B first. I don't care whether you look for it first or second, okay? But it just seems to me, because Sgarbossa B is, look at V1 through V3, again, on a left bundle branch block, it doesn't make sense otherwise. Look for Sgarbossa B, and then what I do is I find all the positive leads, all the uppies, I circle them and look for Sgarbossa A. Okay, so for example here, begin with Sgarbossa B, okay? Is there any evidence of Sgarbossa B there? Any downies with downies? Nope. Okay, no Sgarbossa B. Okay, now what I usually do is I move to Sgarbossa A and I look for all the positive ones, okay? So here, come on. I should have done this all at once. Okay, do I have any others? Yeah, one more. So this is typical. Like you can see there's only 4. So is there any Sgarbossa A there? Any uppies with uppies? No. Okay. So now you're back to where you began. Somebody says, is there a STEMI? And you say, I don't know. Because lacking Sgarbossa, you're back to left bundle branch block land, okay, where you don't know. Okay, so let's do some here. I think, do I have this on the handout? Yeah, this one somebody somebody circled it, it was already on. Okay, go up. Number 1.
V3, Sgarbossa B, there is a downy.
Okay, and do you see any other Sgarbossa B? They only circled 1 lead, but do you see it any other place?
It looks
Even if it's a tiny bit?
V2, a tiny bit.
Yeah, I would say V2 and V3, there's Sgarbossa B. Now, just because there's Sgarbossa B doesn't mean there's not Sgarbossa A, so you still need to look for Sgarbossa A.
Okay.
So tell us, first of all, tell us, because you're the first one here, tell us which leads you're going to look for Sgarbossa A.
A is anyone with upright.
So what are those?
Lead 1, lead 2, lead 3.
Yeah, I'm not sure about lead 3, but you might as well look. This one's pretty equiphasic, doesn't quite count.
Oh, this would be
Yeah.
majority upright. And then not for V5 a little bit and V6.
Yeah, huh? Okay. So any Sgarbossa A? No, okay. However, there is evidence of Sgarbossa B, good evidence for a STEMI, and this is considered, STEMI activation stuff. Again, whether they believe a paramedic depends on your protocols, depends on your training, but at the very least, you should point it out and let them deal with it, however they deal with it.
For both criteria, you just need one.
Excuse me?
For both criteria.
Yeah, so what I would say on this one is I have left bundle branch block and I'm seeing Sgarbossa B, meaning ST depression in V2 and V3. And if they question me further, I would say, Downey with Downey, what are you talking about? So, okay. Okay, so Cody, you want to go next, please?
Okay, so we're gonna start with Sgarbossa B, which we're looking for at Downey, V1, V2, or V3. And I don't see any.
Okay, they're all Downeys with uppies, right?
Yep.
Okay.
So next we'll go to Sgarbossa A, which is in any lead, and uppy.
Uh-huh.
Oh, sorry, so we'll look at V1.
Okay.
Lead 2.
Okay.
Lead 1, lead 2. Lead 4.
Lead 3?
Sorry, V4.
Oh, V4, but don't forget lead 3 AVF. Okay, so there's all of
Oh, yeah.
these
I
are
don't know how I
all
skipped over.
positive, yeah.
Yep.
Okay, and then you're correct, V4, V5, and V6, and what do you see?
No in 1, no in 2. There, so no in 3. No in AVF. No in V4. Yes in V5.
And V6?
And V6.
Yeah. Okay, so what do you got? Put it together.
Left the bundle branch block with Sgarbossa A criteria in V5 and V6.
Correct. Okay. So I agree with, I'm totally fine with you. I think there might actually be a tiny bit in lead 1. It's a little bit equivocal. So that's one of those ones, yes or no, it's okay. Okay, so yes, there is left, I can't remember what question 1 was. Is there a bundle branch block? Yes, it's left bundle branch block. Sgarbossa A in 1, I should put that in parentheses, V5 and V6. And there's no right bundle branch block, so 4 is not applicable. Okay, so Anne, number 3, please. I'm sorry, I just didn't hear. I sort of spaced out.
I do have ST depression in V2 and V3. Correct. Okay. And then I'm gonna look at Sgarbossa A and so that would be lead 1, 2. ADR, ADL,
Okay? Okay, so V2 and V3, correct?
Right.
Okay.
Yeah, B2 and 3.
Okay. So yes, we have a bundle branch block. Yes, it's left. Sgarbossa B in V2 and V3, and question 4 is not applicable. Grace, I don't know about you, but I've been following all the ones in V1. This one definitely has a positive R
But
at the
it's a
start.
left.
Yeah, it's a left.
Gotcha.
So I'm going to stop looking now. Yes. Okay. Yes.
Actually, I don't know. What circus pony is? It's upright C's, right? When you do it. When
Well,
it's kind of, it's basically-
Yeah, but
it's different.
you're right about circus ponies, but remember left bundle branch block obscures possible posteriors as well. So this Sgarbossa B has not, I think you're looking at it and saying, well, it must be a possible posterior. It has nothing to do, like Sgarbossa B has nothing to do with either, or not necessarily with septal anterior or posterior. It's like a whole different thing.
Okay.
Yeah, good question. Okay, so, yes, please.
On like V.
Oh, good, I'm
V5
glad you
and
saw that.
V6.
Yes, yes.
Or,
Yeah, like this one looks like it might be a downy with a downy. Is that
no,
what you're asking
well,
about?
I was more curious, there's like a RR prime and then it goes past the isoelectric line and then is that like an SS prime at the bottom? Does that indicate anything else other than a left bundle branch block? Like, do you see V6?
Yeah, I
how
see
it's
what
got
you,
the
I do
little,
see what you're saying.
like bunny ears on both sides of the
Yeah, I
isoelectric
see
line?
it, and I don't have an answer, I don't know.
Okay.
I don't have an answer on that one. There was, I'll double check, because I do have a left bundle that has a little negative thing in V6, and I remember reading, it was sort of a weird explanation of it. I'll check, so it might follow with this one too.
Okay.
Okay, yep.
What is the rhythm for this?
Okay, so it's regular, I believe,
Yeah.
okay, and
I see.
300, 150, 100 is about a rate of about 80, and they're P waves, so it's just a normal sinus with an IVCD, in this case a left bundle branch block. Yep. Okay, so Grace, number 4, please.
Yeah. So there's left bundle branch block. And looking at V1 through V3, it has down and then up, but then V3 has stays depressed, never goes
Uh-huh.
up. So we're calling Sgarbossa B and V3. And
Okay.
as far as A, do you still want me to do it? If we meet criteria in this, then it's not that.
You just want to do a double check, because I've seen some that have both, so you can do it, you don't have to like do it out loud step by step, you can say yes or no.
Yeah.
Okay,
No, so that's it.
okay. So again, this is Sgarbossa B. Now, I want to look, here are the two mistakes, I'm going to point this out a couple times. The two mistakes that people make with Sgarbossa, you can see it's pretty straightforward. So the two mistakes that people make is, number one, they forget. And I can't help you with that. You just have to remember. You have to study and remember. But the other one that people make is they look at something like lead 1, which is a completely positive. And that's why I pointed out, we already looked at something like this, and I said, can you see the rabbit ears? Can you see the RR prime? And everybody went, yeah, no problem. Okay? But when you're looking for ST elevation, sometimes those rabbit ears have kind of a nasty habit of looking like ST elevation. So, you see what I'm saying? But if you look at the width, like where the J point is, and line it up with the J point below, you go, oh, wait a minute, that's not ST elevation, it's just part of the QRS. So I think the take-home lesson is you have to learn that particular RR prime pattern and not be fooled and think it's ST elevation, okay? There's a couple more that I'll point out when we get to it. Okay. Who's next? Natalie, are you next? Okay.
Okay, this is a left bundle branch block. And then I don't see any of the B criteria in V1 through V3 or any A criteria in the positives.
Correct. So we're back to the beginning. Is there a STEMI? Who knows? Okay, we don't know. Okay, so but we definitely don't see Sgarbossa here. Okay, Brandon, number 6, please.
So this is a left bundle. I didn't find any Sgarbossa B, but for Sgarbossa A, maybe in lead 1, AVL, and then maybe in
Okay.
5 and 6.
Okay. Okay. So, and again, what you will read about Sgarbossa criteria, either A or B, is that it doesn't necessarily tell you where the STEMI is. But in a case like this, how could it not be a lateral? I think it clearly does in this case. It's just not, you can't depend on it to tell you where it is. Okay? And remember, if you look, remember that Sgarbossa B, well actually it's not, only refers to V2 through V3. So don't be confused if you see something in lead 3 that looks just like Sgarbossa B. It doesn't count unless it's over here. Okay? Questions? And again, here's another one of those sort of nasty rabbit ears. Remember, that's not ST elevation, that's the RR prime. Okay? Okay, 7, Brandon, it's you. Hmm? Oh, did you do it? Sorry. Okay, Kyle, sorry.
That's a right bundle branch block.
Okay, is there a STEMI? Don't forget, with right bundle branch block, you can see if there's a STEMI, and that's that 4th question.
No.
No, okay. Okay. Okay, number 8. Have we done this one before? Doesn't matter, I guess. Riley, number 8, please.
All right, there's a left bundle branch block. It looks like, oh, hold on, we got some downy in V3.
Okay.
And that is the only Sgarbossa criteria I can see with it.
Perfect.
So that would be Sgarbossa B.
Perfect. Okay. Number 9, Cody, please.
Alright, so this is a right bundle branch block.
Good.
I see SD elevation in V2 and V3.
Good. Okay. Okay, questions? Okay, number 10, Koa.
It's check that as a left bundle branch block. Sgarbossa B and V1, V2, V3. There is no criteria for Sgarbossa B. And Sgarbossa A, lead 1, V5, V6, AVL. I do not see Sgarbossa A criteria.
Good.
So it's just a left bundle branch block.
Okay, anybody want to argue with that, or are we all good with that? Okay? No, we're good. The only reason I said that this is the exact one where people start talking about this being ST elevation here, and that's perfect that you didn't see it. I mean, because it's not there. Okay, and in fact, this is the one where I have the line, so you can see if you think, oh, is that ST elevation? No, it's just, see how it lines up with the QRS, and so that's just RR prime. Okay. Number 11, Anne, please.
I'm seeing for Sgarbossa B, depression in V2 and V3. And then for ST elevation in ABL. B4, B5, and B6, and I don't see.
Okay? Yeah, good. Okay. And what is it that I want to do here? I'm not sure why I did that. Okay. Okay, 12, Grace.
QRS is less than 100 milliseconds.
Any Sgarbossa?
Well,
Yeah.
90% of
Yeah. Remember, we only use Sgarbossa with left bundle branch block. We don't use it with narrow QRSs because there's no bundle branch block, and we don't use it with right bundle branch block. Okay, last one, Natalie.
The last one is a right bundle branch block. So we don't use Sgarbossa, but it is a stem.
But excuse me?
There is a STEMI.
And where is
it? Interior septal.
Okay.
It'd be
Yeah.
like B2.
Correct. And the reason I left the printout in, I won't do this on the test, by the way, is, there is this absolute pervasive belief out in the paramedic community that you cannot tell a STEMI in a right bundle branch block. And it's just wrong. I mean, there's no two ways about it, it's wrong. And so first of all, you can see it, and then I said, okay, I'm going to use I like the printout when it agrees with me, so I'm going to put it in. So, okay, so we're almost done. A few more things in this lecture, and then we'll take a break. Further notes, remember only singles needed. The location does not necessarily indicate, so when you're calling it in, if you have Sgarbossa B, don't say interior septal, just say, I have Sgarbossa criteria in V2, and be prepared to explain what you're talking about, because they might say, what does that paramedic know about Sgarbossa? And again, the presence of a Sgarbossa criteria is good evidence, but lack is you're just back to where you began. If Sgarbossa doesn't exist in somebody, if you're just looking at the left bundle branch block, somebody says there's a STEMI, you look quickly for Sgarbossa, you don't see it, your answer is, I don't know. I can't tell, it's a left bundle branch block. You don't have to know this, but I'm putting it in case you're interested. The original Sgarbossa C, like Elena Sgarbossa's original criteria for C had to do with the amount of ST elevation, even if it's downy with uppy. And her original criteria C did not pan out. It didn't work. It was adjusted to be that if you have ST elevation that is greater than or equal to 25%, so from isoelectric line to J point, if that's greater than 25% of the S wave, so start of the QRS to the bottom of the S wave, that counts as Sgarbossa C. I think that one's harder, it's harder, because you have to really measure it and so forth. And so I don't require it. I think that's a harder one to do in the field, because again, it doesn't work unless it's really precise. Not that we can't be precise, but not necessarily in that circumstance. So questions about this? It will be on the quiz, and then the homework, there's a slight, I passed out the homework already. It says BBB practice with Sgarbossa. There's a slight inaccuracy on here, and I just want to point it out. It says the answers are posted separately in the Sgarbossa folder. They're not. If you look under modules where you see homework, practice and homework or whatever I say, it's listed in that as Sgarbossa homework. That's this, and the answers are right there. It's no different than normal. You'll figure it out. Okay. Okay, so let's take, what time is it? It is 9:51, 10-minute break, so 1 minute after 10, and we'll come back and talk about hyperkalemia.